A warm and graceful evening to one and all. It is my privilege to welcome all the participating veterinarians, that may be students, faculty, researchers, and scientists, to today's webinar on control of subclinical parasitism in animals. It is also my privilege and honor to welcome today's guest of honor, Honorable Dr. Ashok Kumar sir, who is Principal Scientist in Veterinary Medicine in ICR CRG Makhdoom UP, and Mr. P. Karunanidhi, Senior Vice President, Alembic Pharmaceuticals Ltd. Now, I will invite Mr. P. Karunanidhi, Senior Vice President, Alembic Pharmaceuticals Ltd, to introduce our today's eminent speaker. And all this webinar is under guidance of Mr. P. Karunanidhi sir. So, over to P. Karunanidhi.
For the participant, all the participant, good evening to all of you. Actually, normally Alembic is doing lot of such webinars. Most of the time, normally we get professors, head of the department, sometimes dean, we get as our speaker. This time, we have got a principal scientist as our speaker. So that is really a good development for us. Dr. Ashok Kumar is an MVSc PhD, principal scientist in Central Institute for Research on Goats, situated in Mathura, UP. So, like many veterinarians, he also, after completing his graduation, he started his career as a veterinary officer in Department of Animal Husbandry, UP. Then he moved into college for the teaching profession because of his interest and dedication in that line. So he joined as an assistant professor, Department of Medicine in the College of Veterinary Science and Animal Husbandry in Mathura. Then promoted as a senior scientist in veterinary medicine, CIRG in Mathura, same place. In 2007, promoted as a principal scientist. His academic contributions are, he is an advisor for 14 MVSc students and 6 PhD students, and completed 10 research products as a co-principal investigator and 8 extramural projects as a co-principal investigator. He is good in clinical diagnosis, disease management, development of herbal drug. So he has 125 research papers to his credit, and also he has reviewed many articles, lead papers. And also the most important is that he has 5 patents in his name for drug research and commercialized 9 product formulations, and also attended various conferences at national level and international level. The most important thing is that he has worked as a visiting scientist to United States Department of Agriculture at Pennsylvania. He has written 3 books, including a book called Goat Production and Supply Chain Management in Tropical Countries, published by a UK publisher. He is a fellow of 2 professional societies and 3 professional society awards he received so far. So, as we say, all the webinars, that Alembic is committed for this continuous veterinary education for the students, also for the field veterinarians. So, in this line of our effort, and today is one of such webinar, and we are lucky to have Dr. Ashok Kumar as a speaker in this. So, thank you very much, and we will be conducting such programs in future also, and I request all of you to participate and get maximum benefit out of it. Thank you very much.
The economic losses due to parasitic diseases. So it is very clear it is affecting the animal health. It is affecting the animal performance, animal production to the all class of the animals. So ultimately it is threatening to the profitability of the animal production. Besides the affecting the animal health, production, performance of the animal, it is also affecting the reproductive efficiency or reproductive behavior of the animals. There are certain examples. in the literature and the research that these are responsible for affecting the reproduction, because in the productive animals, the reproductive efficiency is a very important parameter. There are certain examples like the trichostomiosis in the eve and lambs. They are responsible for the delayed attainment of puberty. Trypanosomiasis in ram, choreoptic mange has been found to be associated with the testicular degeneration or agiospermia. Trypanosomiasis or subclinical mange in eves are responsible for poor consumption rate or reduced number of ovulation. Toxoplasmosis, it is very clear in pregnant eves in causing the abortion. So the reproductive efficiency is also being checked or minimized or hampered by the number of the parasitic diseases. There are certain studies being carried out on the economic losses due to the parasitic diseases. So, as you know, the vector is playing a very important role in causing of a disease. So there are certain examples where the vector is causing a disease. So the economic losses has been calculated on the basis of the vector itself causing a problem, plus they are transferring the disease, and the expenditure is made on the control of the vectors. So it is a total amount of economic losses caused by the vector-borne diseases. There are the number of examples. Here you can see the house flies, stable flies, tabinet flies. They are affecting the milk production, and they are responsible for the decrease of the body weight per day, and also responsible for decreasing the feed efficiency by 16.9%. The mosquitoes and other flies, they are responsible for the transmission of different diseases. So because of the losses, because of the diseases, because of the control, and there is a huge losses in the milk production and weight gain to the level of 15%. Similarly, in the mosquitoes, lice, they are directly affecting the economics, or they are affecting the animal health. So the investment or the expenditure, because of that, it is very high. Mange and mites, cattle, ticks, and the different class of the ticks, they are responsible for the economic losses to the farmers directly or indirectly. There are certain studies in India to study the economics because of the parasitic diseases. They calculated the economic losses of rupees 97.37 crore in adult and 21.79 crore in the sheep due to gastrointestinal nematodiasis. The net economic losses of 195 rupees per sheep has been recorded due to gastrointestinal nematodiasis. So it is a very huge loss. In case of the subclinical conditions, this loss is not being recorded, not visible. So it is further very important. And it is an indirect calculation. When you are going for an anthelmintic treatment, there is increase in the milk production to the level of 4 and 18%. It means they have the importance in the economics or the production performance of the animals. Now the parasitic diseases are occurring in the two phases, either the clinical phase or the subclinical phase. The clinical disease means when there is a high load of the infection and the disease is very visible to the farmers, to the clinicians, and they are going for a treatment, and then they are going for a preventive plan to control the infection. But the most of the time, when the low grade of the infection, animal is sustaining the infections and there is no visible clinical sign in the animal. However, they are affecting the physiology of the animals, they are affecting the production of the animals, but they are not visible to the farmers, even to the sometimes the professionals also. So and more importantly, it is very difficult in the free range animals when the farmers are going, have been presented and already been seen by the participants. Okay, next one. Next. Okay, now we are discussing the two important slides. One is when the diseases are occurring in the two phases. Either the parasitic diseases are in the clinical phase, when the load of the infection is very high in the animal, and because of the high load, the animal is suffering from the clinical phase of disease. And these are very easily identified by the farmers, clinicians, and they can better plan the treatment strategy. If the infection is low grade, where the animal is not showing clinical sign, it has become very difficult to find out the disease. And especially it is very important in the free range animals when the animal is reared by the farmers level and they are not able to identify it. So the economic losses is very huge in such a class of the animals. So the low grade of the infection is of paramount importance to the farmers. The outcome of the infection is depend upon the number of the factors. For example, the host resistance. Some of the animals to the parasitic diseases are highly susceptible, and some of the animals are bearing the load and they are not exhibiting the signs, and some of the animals are not having the high load of the infections or a minimum load of the infection. They are worm resistant. The level of the infection is also very important. If it is high load, you will have a clinical sign. Different type of the infection involved. Sometimes there is single type of the infection is in the animals, and sometimes there is a different 2 or 3 type of the infections. So outcome depend upon that thing. If there is a resistance in the parasites because of the anthelmintics, the outcome is also depends, because you are using the medicines and you are getting the right benefits. It is also the extent of the appropriate therapeutic interventions obtained by the farmers. Means if the farmers are using the right enthelminting with the right dose, the outcome is very good. Otherwise, in the most of the cases at the farmers level, either they are using the low doses or they are sometimes using very high doses. So if you are committing a mistake on the lower dose, it is a sort of a crime. And if they are using a little higher dose, it is not a crime. It is better to commit the mistake on higher side, not to the lower side. Next one. So there are other factors which is favoring the parasitism, like the feeding behavior or the grazing behavior. If you see in the sheep and cattle, the animals are close grazers. So they are more vulnerable because they are easily pick up the infection from the grounds and they are having the high load of the infection. If you see the other animal like the goat, which is not a close grazer, it is a browsing animals. So the load of the animals is comparatively lesser in this class of animal. The load of the animals is also dependent upon the climates. The climates means if the egg is translating very easy in a particular season, for example, high humid season where the translation of the egg to the more active phase is very easily, for example, in rainy season, it is very high. The dense pastures means the animals grazing in an area where there is a sort of, I mean to say, no proper lights or there is a dense pastures, so they are better protecting the developing larvae, so infection rate is very high. The poor housing condition, it has a direct relation with the high parasitic loads, because you are keeping the animals in sites where the high load of infection, you're not having better cleaning strategies, so there is a high load of infection. The type of the diet is also important. The animal is getting the proper diets, proper availability of the vitamins, minerals, and other nutrients. These animals are having better resilience to the parasitic diseases. If the animal is thriving and they are not energy deficient or poor on the proteins especially, the susceptibility of the animal is very high. So the nutrition is playing a very important role in the outcome of a disease. Next one. If you see the immunity to the parasitic infection in the neonates, it is a new to that. It is unknown to that. So it is a very pure immunity when the animal is being born. And colostrum antibody is not very much, and they are not providing a very good protection to the animals, rather a very low protection against the parasitic diseases through the colostrum transfer. And immunological resistance to the nematode parasites can develop over a time. It is not a like that of a bacterial and viral. It is providing a better protection. The resistance is provided for a very long time. It needs a continuous exposure to the parasites to develop a immunity. So it is sometimes it has been stated that since as long as the parasites inside the body of the animals, there is a resistance to the infection. Next one. So in parasitic disease in animals, there are the two types of the life cycle. Either the parasitic having a direct life cycle, means there is a no intermediate host in between. Animal is getting the infection from the grazing areas. and there is a passing of the stage like the eggs, and then again there is a possibility. So there's a direct life cycle of the parasitic diseases, and they are more dangerous because there is always a high load of infection. If there is through intermediate host, means there is intermediate host, so this availability of the host depend upon the parasitic infestation. So in this class we will discuss some of the important parasitic infection, and there are some representative example. Then we will go for the broader option for the control of the parasitic diseases. Next one. Now we discuss the first disease, and the protozoan class is the coccidiosis. The coccidiosis is a protozoal disease caused by the Eimeria, and this coccidiosis is occurring in the different phase of a disease. It is acute disease, subacute disease, chronic disease, clinical disease, subclinical disease. In the clinical phase of a disease, when the animal is ingesting the large amount of oocyst, it is suffering from the severe diarrhea, blood loss, and sometimes there is a death of the animals. But in the subclinical coccidiosis, which is very commonest in the younger stage of the kids, that is starting from the 2 month to the 6 month of age, and the animal is bearing a load of the coccidia, and then coccidia is passing through a life cycle that is damaging the intestinal epithelium in the different stage of the zygony and mirogony. So the animal, whatever is eating, is not getting the body weight gain. So there is a poor appetite and poor body weight gain occurring because of the subclinical coccidiosis. Next one. So in coccidiosis, since this is a disease which is majorly common in the younger stage of the animal, 2 to 6 months of time, and overcrowding is the main predisposing factors. There are different options for the treatment of the coccidiosis, and the drugs which is commonly being practiced to treat and to control the coccidia are sulfadiamidine, and the long-acting sulfadiamidine, nitrofurazone, amprolium hydrochloride, and tolterzurine. If you see the clinical phase of this coccidiosis, it is managed by the electrolytes, by the antibiotics. Sometimes antibiotics are required in the active phase of the disease because there is a lot of denudation of the epithelium and there is a possibility of the bacterial infection. So the antibiotics also sometimes works in the acute case or when there is a diarrhea and dysentery. Probiotics are being practiced to maintain the flora of the intestine. The anticoccidial are mainly occurring in the active phase of a life is have a limited value. So whatever you are using anticoccidial, they are coccidostat in nature, and they are acting over the early stage of the reproductive life cycle. And early stage of reproductive life cycle means when the animal is ingesting the oocyst, it is causing the different stage of the zygony, first stage, second stage, and then it goes to the mirogony to develop a oocyst. So if you are using the coccidostat in the active phase of life, you are minimizing the number of the additional cases. And the number of the drugs are used. Among these drugs, the sulfadiamidine is an antibiotic, and these antibacterial drugs is having a distinctive advantage in the active phase of life. And sulfonamide is also a medicine which is being advocated in the early stage of their life. What is the reason behind it? Because the early infection of the animal because of the oocyst, that provides some degree of the immunity. If you are using the other class of the coccidostats, for example, nitrofurazone, amprolium, they are acting on the early phase of the zygony. So early phase of zygony means as early as you are using the infection, these drugs, you are also, I'm saying, keeping away the animal from the natural immunity. So it's a better approach to use the sulfonamide in the early phase of life. Then if there is a occurrence of a disease, the better options are the amprolium and tolterzurine. So in the treatment and the prevention, in treatment, you are using the therapeutic doses. In prevention, you are using the half of the dose and you are extending the period of the treatment as a preventive measures. Next one. The coccidiosis is always a problematic in the animals, either it is in the clinical phase or in the subclinical phase. So there is you need a very perfect rearing management system. The most important is that the infection are coming through the infected pellets. So as early as possible, the pellet is being removed. I would say the fecal pellets, it is being removed, or it is being removed as early as possible. You are checking the further cycle of the coccidiosis. So it is being practiced in the organized farming sectors. You are having the better feeding, I would say the better feeding devices where the feeding material is kept in above the grounds, so there is a limited access the infection, and then animal is being raised on the raised platform, the wooden platform, raised platform. So the fecal pellet is dropped down to the surface, so there is no possibility of the recycling of the infection. It is also working. The long-term management, the other antibiotics, the ionophoric antibiotics like monicin has been practiced. And since the government of India has banned all the growth promoters as antibiotics, so they are related with the drug resistance, they are not being practiced now. Otherwise, the monicin is a very effective medicine to control the coccidia in the organized sector. But later on, you will find, you will feel, and you will also experience the resistance to the monicin in the coccidia. Next one. And another class of the infection, that is the tapeworm, cestode infection. This is also occurring in the different grade of the infection. If the animal having the high load of the infection, the tapeworm is causing the problem in the intestine. If they are occupying the large surface of the intestine, large volume of the intestine, it is checking the absorption and assimilation of the food materials. And especially in the younger animal, cestodes are of importance. In adult animals, although they are carrying the infection, but they are not causing the clinical symptom in the adult animal. But in the younger animal, sometimes it becomes a problematic. In early phase of life, sometimes we are not predicting these cestode infections. You have to be very careful. In early phase of life of the animal, if they are not gaining the body weights, tapeworm is one of the reason. And the animal is carrying the cestodes in the intestine, such animals also prone to the enterotoxemia, because in between there is a creation of the anaerobiasis. In anaerobiasis, enterotoxemia sometimes proliferates, Clostridium perfringens, and animal death because of enterotoxemia, sometimes not because of the tapeworm. So you need a special attention in the diagnosis and the management. And you know, in the cestode infection of either class, they need a special class of anthelmintics. You need a different class like nucleosamide, praziquantel. Sometimes the fenbendazole in the higher dosage for a long term is also very essential. But in the control management of the cestode infection, the treatment of the adult animals is also sometimes also become important strategy, because the infections are coming from the adult animal to the younger animals. So it is a better approach to treat the younger animal and treat the adult animal for a elimination of the parasite from the organized farm or from the animals. Next one. If you see the gastrointestinal nematodiasis, I have selected a very specific, very important and highly pathogenic parasites, that is Haemonchus contortus. It is causing the infection in the sheep and goat. It is residing in the abomasum and is a blood-sucking parasites. And sometimes the infection load is very, very high, that causing a anemia. And because of anemia, there is a sudden death sometimes in the animals. So it is having a different degree of the infection. It is clinical also, sometimes very acute also, subclinical also, and all the grade of the infections, and they are causing the problem to the animal as the infection load is there. It having a direct life cycle, means the eggs are in the grazing area or in the premises, and they are directly getting the eggs and directly taking the infective stage, that is the third stage larvae, and causing the infection. So it is a very important to identify this infection in the periodically in the animals. There are different options for the management of the Haemonchus contortus infection in sheep and goats: tetramycin, albendazole, morental, or doromactin, I would say the ivermectin. They are all effective and they are eliminating the parasites. But if you see next slides, if you see in the next slides, the load of the infection has a direct correlation with the color of the mucous membrane. As the load is very high, the anemia is very high. So the load of the infection can be predicted by the degree of the anemia in the mucous membrane of the eyes. It has a direct correlations. So now it is being practiced that if the animal having the high load, they are being dewormed. So two practices being advocated by the veterinarian. Either you go for a mass drenching of the animal or to the all animals at one time, or you can go for a targeted therapy. Means where the animals carrying the high loads, they having the high anemia, or you can have a prediction that there is carrying a high load because of the anemia. You can go for a selective treatment with the drugs. So this approach is known as pharmacia approach. You have a color cards, you match the color of the mucous membrane and predict the loads, and according to the advice you can go for a treatment of the animal. These things save the cost on the anthelmintics, is also unnecessary medication to the animal which are not having a more impact on the health or the production of the animals. Next one. So another the class is the trematode, that is the Fascioliasis, a very commonest disease, and this is caused by the Fasciola hepatica or the different other species in the different other animal species. But they are the liver flukes, means they are occurring in the two phases. One is the immature phase, when the animal is grazing or they are accidentally taking the high load of the metacercaria from the infected ponds. And these metacercaria, when they are going to the system and they are reached to the liver, and a large number of the immature parasites is damaging the livers, and they are causing a problem, an acute problem or fatal problem. Animal died sometimes. But in a chronic case or the subclinical stage, the animal, the parasites is living in the livers and the bile ducts and having the low grade of the, I would say the low grade of the clinical, low grade of the disease, and they are reflected in the different ways, either the anorexia, progressive weakness, depression, or there is a deficiency of the protein resulting in the form of a bottle jaw. But in this case, the opting of a right medicine isn't very important, because in outbreak where the large number of the immature parasites is infecting and damaging the livers, you need a different medicines. Whatever the medication available for the fascioliasis, they are all not are working on the all stage of the parasites. Some are very effective against the immature stage of the parasites. Some are very effective against the mature parasites, which is the later stage of the parasitic infestation. So you have to opt a drug which is the immature, killing the immature parasites in the outbreaks, and later the mature one. So you have different option. There is one medicine, triclopyrdazole, it affecting the all stage of the parasites from the immature to the mature. So the most perfect medicine. Otherwise, the clocental is affecting on the younger stage, and the chlorcelone is also, they are affecting the adult animal, oxychlorogenide. So you have to select a medicine rightly at right time of the infection. Next one. The immature paramphistomiasis is of again a similar type of the infection, which is also a require an intermediate host, that is a snail. When the animal is ingesting the metacercaria and they translate it into the next stage in the intestine. When it's reached to the intestine, and after the reaching to the intestine, it is revert back at the maturation stage. At this stage is causing the high level of the inflammation to the intestine when it is going back and reach to the final destination, that is the rumen. So during this stage, there is a clinical diarrhea. Again, this depends upon the load of the infection. There may be a very acute diarrhea, there may be a mild problem, but ultimately during the course of a life cycle, these paramphistomes reach from intestine to the rumen. And the rumen, if you see these figures, you will find a lot of mature parasites attaching to the ruminal epithelium. Although this stage of the parasitic infestation is taken as a non-clinical stage, but the veterinarians which are having experience to work in the slaughterhouse, by the way, they are having opportunity to open the rumen, you will find sometimes a very large surface is being covered by these mature paramphistomes. So these are blocking the absorption. They are decreasing the rumen absorption area. Ultimately, they are affecting the physiology, affecting the nutrition of the animal, and there may be a production losses. So this stage also need to be a consideration. There are the different medicines being used for the paramphistomes like rifaxinides and Trodex. So they are very effective medicine. Next one. See, next it is the Cinereus cerebralis. That is good. It is a intermediate stage of the tinea. It is a commonest problem in the sheep and goats when this cyst is being reached to the brain and then occupying the brain and causing the variable degree of the damage in the brain, and there is a variable sign, that is a neurological sign being observed by the farmers. So this is sometimes very important, and sometimes not being identifiable to the farmers level, because there are certain other clinical associated problems or similar, I would say, the diseases which is having the similar clinical sign. So if it is being diagnosed, it is being diagnosed at the early stage, you can have a better approach. So CIRG is very prominently is working on this disease, and they have developed a ELISA to identify the cyst at the early stage or in a circulating stage. So you can have a better approach for a treatment at right time or the culling of the animal at right time. Otherwise, the surgery is the only option in later stage of this disease. Next one. And the next is the Ascaris. It needs a special attention to the veterinarian because Ascaris is causing a problem in all type of the livestock. It may be pig, it may be horse, it may be buffalo and cattle. Especially if you see the Toxocara vitilorum in buffalo and cattle, it having a very significance in the neonatal mortality. In calf mortality is having a very significance because the Toxocara sometimes is occupying the larger space. Animal become weak and is not absorbing or not assimilating the nutrition or the milk. Animal is having a poor growth or the diarrhea. So this needs a special attention because sometimes we are not able to diagnose when there is a subclinical animal. So it is being practiced, it is being advised that at the stage of the 2 to 3 week of time of the calf, the anthelmintic, especially the piperazine, is advocated to eliminate these parasites. Otherwise, this is causing a problem, and the lot of negligence is there in the field by the farmers, and there's a mortality because of it. So this is need a special attention. Next one. Another disease which is canine disease and causing a lot of confusion in the mind of the veterinarians. It is either acute, subacute, sometimes not visible on the occult form of a disease. That is the heartworm disease caused by the Dirofilaria amitis. It is a microfilaria disease, and the microfilaria is being transferred by the mosquitoes to the dog, and then they reach to the dog and to the final destination, that is the heart chambers and the pulmonary arteries, where it is being reside finally and is being adult there and remaining for a very longer of time, to the 5 to 7 years. So it depends upon the load of infection. Sometimes there is a high number of the parasites, high number of the microfilaria, adult parasite, I mean to say in the heartworm or the heart chambers, there is a different clinical sign that is being exhibited as intermediate coughing, dyspnea, heart failure, vomiting, anorexia, weight loss. But sometimes the load is not very high, so they remain in the heart chambers, not visible. This is known as the invisible or the occult form of a disease. You need a very special molecular test to diagnose I would say the occult form of a disease, that is by PCR or ELISA. So there are the different medicines being practiced. Ivermectin is the very commonest one. in combination with the doxycycline used for a very longer time. Although there are certain effective medicines like melasomine and are available for the treatment, but more important, this disease sometimes need a high attention, because by the way, the animal is carrying the load of the diarrhea and you're not predicting, and you are treating the animal for other diseases, for example, ectoparasites, internal parasites, and by using the ivermectin. And ivermectin is very effective in killing the parasites. So although you are using for the different class, but it's also affecting the heartworms in the chambers. So the death of this diarrhea, adult diarrhea in the heart, they are causing the toxemia, and animal may die also. So wherever there is endemicity of a heartworm, it is always have a precaution that animal should be diagnosed first for the diarrhea, then you go for a treatment with the other diseases. Otherwise, sometimes there is a very miss happening. Hemiprotozoan, next one, hemiprotozoan infection is of different category. It's very common as trypanosomiasis, babesiosis, theileriosis. So the acute phase is very common to the veterinarians and to the farmers and easily identifiable, and a lot of options are there for treatment. But the subclinical stage is also very important. Although you are not having a lot of health problem, but it impair the physiology and impair the health and affecting the performance of the cattle. Next one. So Ascaris, again, the different grade of infection, you have a lot of option. But most important thing is that this is being neglected by the farmers. So the better approach, whenever there is a sizable infections, the animal is being, sprayed by the ectoparasicidal drugs available in the markets. Next one. Now we come to the treatment approach to the parasitic infections, either the clinical or non-clinical. The anthelmintic treatment is most commonly practiced because it increases the productivity by more than 20% if you are using the anthelmintics. And for a anthelmintic treatment, we should know the current epidemiology in a particular area. If you know the epidemiology of the parasitic, I'm to say the spectrum of the parasites in a particular area, so you can have a better approach at what time you have to use the anthelmintics. So in the parasitic infection, and you have to make a continuous observation on the sickness or the behavior of the sickness behavior. For example, it has been a correlation that inappetence and the rumination pattern is being affected in the gastrointestinal nematode infection. There is a regular monitoring of the body score, like fecal consistency, fecal ova counts, and it is being advised in the organized farming sector. You have to go for a fecal examination for the EPG egg per gram, at least in the 10% population. Then you can go for a different strategy for use of a treatment. Either you are using a mass drenching, it is a strategic one because you know at what time there is a high load of infection, you are advising a treatment. Another is a tactical treatment. Tactical means whenever there is a high load because of some sudden climate change, there is a lot of infection is available in the premises or in the grazing area, you have a ad hoc basis, you can have one dose of anthelmintic. The targeted therapy, as you have been seen in the bronchosis, whenever there is a high load, then you are only advised for a targeted therapy. Means whenever the animal there is a load, there is a treatment. There is also approach is being written in the literature, that's the parasite in refugia. Parasite in refugia, it means some of the animals is not being dewormed. That is no anthelmintic being used. Means it is for the maintaining the susceptible strain of the parasites. Because if you are using the anthelmintic in all animals, there is a possibility that the anthelmintic resistance strain is being developed in the whole farm. So there is a strategy being advised that you maintain some of the animals. It is classed as a refugia animal where the susceptible strain is being maintained. So they may dominate at some point of time, and you can avoid some level of the resistance in the parasites. Next one. Yes, the chemical residue in meat and milk is an important consideration, because when you are opting and selecting a drugs, if it is being coming through the meat and milk, it should be in your knowledge, because you have to transfer information to the consumers at what time say the days this is being secreted through the milk or it is available in the meat animals. So thiabendazole is one of the oldest anthelmintics and which is being used, and a withholding period in the thiabendazole is very less because it is very quickly being cleared from the system. So this is the advantage of this drug, because it is being cleared very easily. There's no problem of residue. But the disadvantage is that it is being cleared very easily. So the efficacy is not as a good efficacy to the parasites. So considering all these things, the another benzimidazole compounds like fenbendazole, oxybendazole, albendazole is being invented. They are having more persistent level in the blood for a longer times. So the milk discard, the meat utilization after slaughter, they need a definitive period of time. There are the different drugs like closental, rifaxitinib. They are combined with the blood proteins. They are remain for a very longer time. So sometimes the consumption of the meat is need a higher time. So up to 30 days, you cannot use the meat. Similarly, the milk also. Levamisole and morental, they have a very short life, so they can be used in the food animals. Ivermectin and doramectin, it need a special consideration because they are not being practiced in the lactating animals. Because up to a 3 week to 4 week of time, this is being secreted through the milk. And this is very toxic to the human beings. So it is not being advised in the lactating animal. So it needs a special consideration, a special message to the consumers. Moxidectin, comparatively lesser than the ivermectin and doramectin. And sometimes, some of the countries, there is no withholding period for the moxidectin. But another derivative of the ivermectin, that is aprenomectin, this is not secreted in the milk for a very high amounts, so this is being used in the lactating animals, and there is no withholding periods. So the withholding period to the milk and meat need to be considered before using, in which class you are using. If you are using food animals, you need a very careful, which having the higher, I would say, the withholding period, and which having the lower withholding periods. It needs a consideration points. Next one. So now we have a different class of the anthelmintic for the treatment of the animals. Benzimidazole compounds, number of the compounds. Imidazole compounds, levamisole, tetrahydropyrimidine compounds, salicylarides. They are having the different activities against the flukes, tapeworms, and the roundworms. Macrocyclic lactones, that comes with the ivermectin, doramectin, and aprenomectin. Miscellaneous class, having the different class. So they should be used periodically, or you have to use in such a way that you are not developing a anthelmintic resistance to the parasites. The anthelmintic resistance means a drug which is eliminating the 90%, more than 95% of the parasite is a susceptible drug, or it is a good drug. If it is not able to eliminate, it means it is a resistant drug. So in the resistance stage, if you want to change the medicine, here they change the class of the anthelmintic, not the same derivative from the same class. Means you have to change the class to the anthelmintics. So now we are coming to the different managemental practices. It is very important. You need a very multi-level and multi-directional approach. Means you have to use a correct, you have to select the correct medicine, you have to use a correct dose, and you have to select a medicine according to the dynamics of the parasites, according to the prevalence of the parasites. So the better host nutrition is an important, because the better nutrition providing the better resilience to the animals against the parasites. And protein having a very important role. If you increase the protein level of the animal, you will find the the parasitic load is minimized. And this is also important, especially in the nematodiasis, when there is a loss of proteins and you are supplementing the proteins, and you are controlling the load of the infection. Housing management, you have a better house, you have a better hygienic house, timely cleaning, smart house. So you're having a low parasitic loads. So you can better control the parasitic damage. Introduction of a new animal means when you are already having the animals in your farm and we are purchasing the animal from a distance, it means there is a possibility of a different different grade of the parasites. Means if these animals are carrying the resistant strain of the parasite, it means you are introducing the resistant parasites. So it is better approach. If you are purchasing a new animal, you deworm the animal with a correct medicine, with the correct dose rate, then you mix with your animal to prevent the resistance level. Regular anthelmintic administration according to the strategy, that is depending upon your area. Rotation of the anthelmintic. Sometimes there is a frequent rotation, means every time you are changing the medicine. So the frequent rotation of the anthelmintic is also creating the problem of the resistance. So there is a advice that you are starting a one medicine or one class of the anthelmintic, you use that anthelmintic till it is effective. So we are practicing this approach for continuously for 2 years. We are using the one class of the anthelmintic, then we change the next class. So you can avoid the anthelmintic resistance. The tactical treatments, whenever there is a requirement, there is a high load of the infection because of the disturbed climatic conditions, you have a ad hoc treatment. Alternative drugs is also having a role nowadays. A lot of research being carried out by the institutions to find out the plant medicine. Certain plants having the high tannin content. The high tannin content has a direct correlation with the anthelmintic properties. So there are a lot of research being carried out, and a lot of products is developed like the condensed tannin. So they are being used to treat the anthelmintics as the anthelmintics, but they are having their own advantage and disadvantage. One of the disadvantages was they are anti-nutritional infectors. So secondary metabolites in the plants, a lot of research has been done, a lot of list of the plants having the property of the anthelmintics, they are able to reduce the PG by 50 to 60%. So this is a very important thing to message to the farmers, that the plant having these secondary metabolites as anthelmintics, they can use in the regular feeding practices to control the infection of the parasites. Next one. The grazing area management, you need a comprehensive plans. You has a better anthelminting, correct dose of anthelminting, and then the grazing area management is also need a consideration. Although we do not have such a practice in the free range animal, but in organized farming system, now it is emerging as a industry. So organized farming system, you have your own area of the grazing. It needs a attention also. For example, the alternative grazing, mixed grazing, because the one type of the species is affecting a one class of the animals, and if it is going to the alternative host, means you are diluting the load or the infection to the other class of the animals. Rotational grazing, you are avoiding the same pasture for a long time, then you introduce a new animal. And besides this, one of the approach is also being practiced, the certain nematophagous fungus. For example, the D. flagrans, it is also being researched very extensively. And it has been observed, this nematophagous the fungus, when it is used in the animals, these spores are being fed to the animals and they grow over the parasites and they kill the parasites to reduce the burden of the parasites inside the animal. So although it is commercial practice, I do not know what is the availability, but it is having a very good effect. A lot of papers are there by using this fungus to control the infection. This fungus is being used for control of the Haemonchus, Trichostrongylis, Ascaris, Fascioliasis, although it is a very good, because whenever there is a resistance, you remember, you search for an alternative. So this is also one of the good alternate. Next one. The vaccination, if there is a pathogen, there is a vaccine. In the microbial and viral, there are a number of vaccines. They're very good vaccine. So this is, this helminthic infection or the parasitic infection, lot of frustration. You have infection, you have enthelmintic, you have a problem of enthelmintic resistance. So a lot of research is also being carried out to find out a vaccine, because vaccine is always considered as a very green approach to control the all kind of infections. So a lot of research being done. For example, the control of the coccidia, the Coccivac or Coccivac vaccine is being developed, is being used in the poultry, and is also being used in these small ruminants to control the coccidia. Although it is not a commonest to control, there is a lot of problem with the helminthic vaccine, because you do not have a very protective antigen. You have a different life cycle of the parasite, so which is the most important you have to take into consideration. So a lot of problem the vaccine development. So Rakshavac in India for the Theileria inolata, commonly practiced. Toxovac is used for the Toxoplasma gondii as it is a live vaccine. And the most important, the most effective vaccine in the parasitic area is a lungworm vaccine. It's the most effective out of that, the parasitic diseases. So there is a international market. The Dictol, Bovilis, Hursvac are the brands which is used for the vaccine against the lungworm. In India, it is also being researched. There is a vaccine being researched, that is a DIFIL against the Diptococcus filaria, although it is not a commercial practice. But in all there is irritated gamma irritated larvae is used. Haemonchus, lot of antigen being identified, especially the gut membrane proteins. They are antigenic in nature. So they are being used as a vaccine. This Barbarex is a vaccine is so being used. So although it is not a very highly immunogenic, it needs a very frequent repetition in the animals and providing for a very small duration of, I would say, the period for that. Besides the Bacillus hepatica, the recombinants approach is being practiced, reducing the burden to the 50% level. So the vaccine is also being practiced, although not very effective, but it is an alternative approach when you are frustrating, and then you can use a vaccination approach. Next one. So breeding of worm-resistant animal. This is also one of the approach. As you know, the animal having a different level of the susceptibility. Some are highly susceptible, some are low susceptible, some are no susceptible. They are classified as a worm-resistant animal. This is being researched in the organized farm, and particularly for the Haemonchus contortus in sheep and goat, we find that there are certain animals which are worm resistant. If you are opting these animals in the breeding plan for a breeding of the animal, you will find the animals are of low susceptible or the resistant animals. So on the same line, ICR CSWRI Abhikanagar has identified a Haemonchus resistant sheep line, which is not being infected or affected by the Haemonchus. Now they are maintaining these lines and they are propagating. So this can be also practiced in the other class of the animals. Next one. I think it is complete. So this is the information to the veterinarian. Although it is a very wide topic, I was very difficult and were not able to, I would say, compile all the information, but whatever the important information to the veterinarians, to the practicing veterinarian has been incorporated. So thank you very much for your patience hearing and giving a time. Thank you very much, sir. It is really highly appreciable the efforts being done by the Alembic Pharmaceuticals and disseminating the updated knowledge to the veterinary profession, to the students, veterinarians, and the other progressive farmers and other stakeholders in a more better way. So it is a very high class of service to this profession. It is appreciable, and I find a very positive attitude of Mr. Karunanidhi, and to providing this platform to the other institutions. Everywhere I find the Alembic as a sponsor, Alembic as a knowledge partner in the other institute organization. So really it is a great job, great service to the nation through veterinary professions. So thank you very much, and I'm really very happy to be a part of that webinar and part of this approach being opted by this great company of the country. Thank you very much.